Hey everyone, today we're diving into something that's going to be a huge part of your career, geriatric care. Now, if you're a medical student, you might think of this as some niche specialty, right? But trust me, it's pretty much the future of your day-to-day practice. So let's get into a framework that's going to help you see the whole person, not just a list of their diagnoses.
Okay, let's just start with one single number, 300 million. Just let that sink in for a second. That's how many elderly individuals were projected to have in India by 2050. And look, this isn't just some random statistic from a textbook. It's a massive demographic shift that's going to completely redefine our healthcare system. The patients you'll be seeing, day in and day out, are going to be older adults with really complex needs.
And this chart right here, well, it shows you just how fast this is all happening. We're talking about the elderly population in India more than doubling between 2021 and 2050. It's an absolute explosion. So, what does this mean for you? It means mastering geriatric care isn't just a nice-to-have skill anymore. It's absolutely essential for every single doctor coming up.
Okay, so we've established the scale of this. But it's not just about the sheer number of older patients. It's about the incredible complexity of their health. We're often dealing with what we call a double burden of disease, and you'll see that a simple one illness at a time approach, well, it just falls apart.
So here's the first part of that double burden. This is the stuff we're all familiar with, right? The non-communicable diseases, the NCDs, heart disease, COPD, cancer. These are, of course, huge. They're major causes of death. But, and this is a really big but, in an older patient, this is never the whole story, not even close.
And this is the second burden. These are what we call the classic geriatric syndromes. We're talking about things like frailty, falls, cognitive impairment, incontinence. See, these aren't neat and tidy single diseases. They're these complex, multifactorial conditions that absolutely wreck a person's function and quality of life. And honestly, a lot of the time it's these syndromes, not just the NCDs, that are the real reason an older patient is coming to see you.
So the big question is, how on earth do you manage all this complexity? How do you untangle this huge web of clinical problems, functional decline, and social stuff all at once? Well, you need a system. You need a framework. And that framework is the clinico-psycho-social approach, or what we'll call CPC.
Think of the CPSC framework as your go-to toolkit for seeing the entire picture. It's designed to pull you away from just looking at a single diagnosis. Instead, you're integrating the patient's clinical problems, their diseases, their meds, with their psychological state and their actual real-world social situation. This is how you create care plans that don't just look good on paper, but that actually work in real life.
And it's actually pretty straightforward. It's built on 4 pillars you can always come back to. First, the clinical stuff. What are the diseases? What meds are they on? Second, psychological. How's their mood? What's their cognitive function like? Third, social. Who's at home? What's their financial situation? And the fourth one, which is so often missed but is absolutely crucial, is community linkage. How do we plug them into the support systems that are already out there?
Okay, theory is all well and good, but let's see how this thing actually works in the real world. We're going to apply this framework to a patient you are definitely going to meet or someone just like her in your community medicine posting. Let's meet Mrs. R. So here's the situation. Mrs. R is 74. She's come in because of knee pain and a couple of recent falls. But listen to the rest of the story. She's a widow, she lives all by herself, her income is limited, and she tells you she just feels low. You can immediately see how a standard workup for just knee pain would miss, well, pretty much everything that actually matters here, can't you? So we pull out our geriatric assessment tools, and look what we find. For activities of daily living, the basic self-care stuff, she's doing okay. But for instrumental activities of daily living, the more complex things like shopping or managing money, she's struggling, she needs help. Then we do the geriatric depression scale, and she scores an 8 out of 15. That's a big red flag for depression. And finally, her timed up and go test, which is a great simple way to check her mobility and fall risk, is 18 seconds. That is way too long. It puts her at a very high risk for more falls.
So what's the story here? What is all this data actually telling us? It's shouting that her knee pain is just the tiny tip of a very, very big iceberg. The real issues are her functional ability, her mood, and her physical safety. And you can see they're all tangled up together.
Okay, now we can build a proper problem list using our CPSC framework. On the clinical side, sure, we've got osteoarthritis, but we also have frailty and a high fall risk. Now look at the psychosocial side. We've got probable depression, social isolation, an unsafe home environment, and financial stress. See how that works? These aren't two separate lists. They're totally interconnected.
If you just treat her knee pain, but ignore her isolation or her risk of falling, your plan is, well, it's just not going to work. It's doomed from the start.
So identifying all these problems is a huge step, but it's really only half the battle. The next critical step is building a plan that goes way beyond the prescription pad. We need to connect Mrs. R to the support she actually needs, right there in her own community.
So this is what a real comprehensive care plan looks like. We're not just handing her a prescription for painkillers and sending her home. No way. We're reviewing all her meds to see if any of them are making her dizzy. We're getting her nutrition support and some simple fall prevention exercises. We're getting her a referral for counseling to help with that low mood. We're even thinking about home safety modifications. And maybe most importantly, we're linking her with a local ASHA worker, an accredited social health activist who can be your point of contact and check in on.
And the best part is, you don't have to do this all by yourself. Think of this as your referral cheat sheet. You need to know about the National Program for Healthcare of the Elderly, the NPHCE. You need to check if your patient is eligible for Ayushman Bharat to help with the costs. You should know about the Maintenance and Welfare Act, which protects their legal rights. And, of course, you absolutely have to know what's available at your local primary health center and any local daycare centers. These are your partners in care.
Okay, so as we start to wrap this up, let's bring it all back to you, the medical student. Your entire career is going to unfold right in the middle of this massive aging boom in India. That's not a burden, that's an incredible opportunity. You have a chance to literally shape a better, healthier future for millions of older adults.
So what's your mission, should you choose to accept it? It's 4 things. First, really master these principles of comprehensive assessment. Make them second nature. Second, and this is just as important as any clinical skill, develop real empathy. Learn how to communicate in a way that's respectful and age-friendly. Third, you need to be an advocate. Stand up for the rights and the dignity of every older person you treat. And finally, be that bridge builder. Be the person who connects the clinic to the community.
I want to leave you with this final thought. Respect for the elderly is respect for our future selves. At the end of the day, geriatric care isn't just about managing a bunch of diseases. It's a direct reflection of our values as a society and as individuals. When you learn to care for older adults with both skill and genuine compassion, you're not just becoming a better doctor. You're helping to build a better future for everyone, including the person you'll one day become. Thanks so much for joining me.